We are providing care for around 650 patients. One of the key areas that we actually use EMIS Mobile is in the field of cystic fibrosis, as we set up an EPR with EMIS Web and PCS in 2007.
So an average day in the community for me is to have a look at my diary, see where I'm going, and do between 4 or 5 visits a day.
I have to attend St James's Hospital, but also the physios and the nursing team come out to me weekly as well.
Before EMIS Mobile, we had pieces of paper or memory that people came back and then put the data on EMIS Web, maybe the following day.
We'd have to write the information down in the patient's home. We'd then have to come back to the unit and upload the information then.
We wouldn't have that real-time information. Things with the patient could change, and I wouldn't necessarily know that when I'm going out to see them.
What we were looking for is how can we put data very easily, and how can we see data very easily anywhere in the world. What EMIS Mobile allows them to do is get the records for those patients and actually add data there and then live.
To be able to do it there and then is a great time saver.
You can use it in patients' homes, you can use it by patient's bedside. It's secure. I can quickly find what the last consultations were, and I can look at more specific observations. So when I'm inputting an observation, it will show me their last observation too beside it, so I can quickly compare without having to go into lots of different places to find that information.
That information's there straight away, so if then the staff back in the unit need to access that information, it's there, so they're not having to sort of ring, find out how was the patient.
I now have the capacity to probably see an extra patient a day.
Staffing is the most expensive, and therefore it does give cost benefits in that respect.
With patients, they know what I know is up to date and relevant to them at the time that I'm seeing them in the home.
It's great to know and reassures me that I know she's got my notes to hand, and I can ask her anything and get an answer straight away.
I think that's really important when we're trying to build a rapport and you're trying to work with somebody and you're trying to get the best out of them. The more you know about them, the easier that is.
What's really important is that you can use EMIS Mobile when there's no Wi-Fi network if you downloaded records. That's really imperative because of the poor network cover in certain parts of Yorkshire.
Patients get an overall better experience. Everything is more streamlined and it's in real time. I can't imagine going back to a time without EMIS Mobile.
I would highly recommend EMIS Mobile if you are seeing people outside a physical building.
My overall care from St James is absolutely fantastic. All these modern technologies that are coming out that are making it easier for them and for us as patients, it's brilliant.